Today we are doing a iTIND device. iTIND is basically an implantable titanium nitinol device, and this is basically for reshaping the prostate. This is a device we will show you how to employ it, and this is for the first time being done in India, and this is how this device is. So it makes a Mercedes-Benz trifurcate incision in the prostate. This is the lip, and इन पेशेंट्स वेयर देयर इज़ अ हाई ब्लैडर नेक, जिन पेशेंट्स में हाई ब्लैडर नेक है या फिर टाइट ब्लैडर नेक है, यंग पेशेंट्स हैं, कोई इजैकुलेशन की प्रॉब्लम्स होती है बिकॉज ऑफ अल्फा ब्लॉकर या अल्फा ब्लॉकर जिनमें काम नहीं कर रहे हैं, तो उन पेशेंट्स में iTIND डिवाइस गोइंग टू बी वेरी फ्रूटफुल बिकॉज there is no incidence of retrograde ejaculation or any ejaculatory problem after putting this device. It can be done under local anesthesia, and within 5 minutes we are able to put this device and the patient can go home same day without any catheter. So if you are looking at a truly minimally invasive treatment for prostate, I think iTIND has a place there, because there is no implant which is inside your body. This implant is removed after 7 days, and there is no catheter also. So the fear of catheter, the fear of implant is not there, and there is a same day discharge. And we'll show you how it goes inside. So first of all, we have to do a rigid cystoscopy, and this procedure can be done under local anesthesia. So this is the rigid scopy where you insert the catheter. This is the rigid scope, which is around 20 French, and as one can see on the screen that this is a high bladder neck, and this patient has a Qmax of around 11 ml and a small prostate. So once we have inserted the device, we take out the cystoscope, telescope, and then on this device, this is the white marking and this is the blue marking. So the blue has to be at 12 o'clock looking towards you, and this device goes inside. Now you have to push the device. So once it is inside, one can feel that there is a give way. So this give way feeling occurs, and then we take out the outer sheath. Now go inside. So this is the device inside. Now during this placement, we check this. So now the position is all right. We withdraw the scope till the prostatic urethra, and then we also So now we can see that there is a blanching effect coming, and okay. So now, so this is important. This thread, the patient doesn't have to pull this thread. Post-operatively, there may be slight irritation because of the thread coming out. So one can use petroleum jelly or Vaseline to decrease the irritation in the meatus from where the urine is coming out. And you loop this thread, and then certain amount of slack is left. ये थोड़ा सा ढीला छोड़ना है ताकि रात में जब आपको इरेक्शन आए तो ये आपको परेशान ना करे. ठीक, तो ये इसको ऐसे करके आप लगा दीजिएगा सर.